Hi, my name is Carina Yang, and I'm an associate professor of radiology at University of Chicago, where I also serve as the vice chair of diversity and inclusion and director of pediatric neuroradiology. Today, I'm going to talk about the challenge we continue to face with relatively low numbers of females in radiology, and specifically touch upon the challenges in exposing medical students to the specialty, misconceptions about the specialty, and why there's a lack of female leadership throughout our field. So the first reason I think that we have in terms of not having enough women coming into our field is that we are lagging behind in attracting them to our field. There's still not enough female leaders in our field, and with the trickle-down effect, we have fewer females who are training to become radiologists. Students aren't seeing the strength in numbers at the top in terms of the leadership ladder and likely question the ability to successfully navigate the field. We are still inaccurately viewed as a specialty that doesn't have as much direct impact on patient care and not really investing enough to specifically recruit females to our field. And this includes promoting the advantages of our field, such as the flexibility that we have in our schedules, and better work-life integration, including easier options for going into part-time work and transitioning in and out of that, teleradiology, all those things are not sufficiently highlighted, I believe, especially to attract females into radiology. This also has a base in the amount of exposure we have in our med students to our field. This really affects the number of students that may be looking to enter it. If they don't have that exposure and they don't have the right opportunities to explore our field, then they'll never realize what a great field it is. The current exposure for many is just a phone call to our reading room to sort of touch on follow-up imaging for their patient, much as one does for like a lab that was drawn on your patient and to look up the results. There's not enough of an immersive experience. And if anything, I think the needle has gone in the wrong direction where we're actually having less required clerkships in radiology. At our institution included, we had a required clerkship that has now become an elective. So we see far fewer students now rotating through. To introduce med students to our field, we really have to catch them really early on. And there should be a big overhaul or relooking at our med school curriculum across the US. Because radiology is really important to any clinical medical field and can be easily fully integrated and actually taught by radiologists at an earlier stage. There are also a number, I think, of a number of stereotypes that females probably place more weight into in terms of our field. So one of the misconceptions would be that we don't have any direct patient care or patient interaction. And of course, that's not the case. Many of our subspecialties does allow a lot of direct patient interaction. I think especially the procedural components of many of the subspecialties. Also, much of the work, I think people believe is done in a dark reading room, and people probably think that we're very isolated and don't talk to other people. I think some of the subspecialties have more interactions directly with staff and patients, especially those with more procedural components. And even if we don't, we have high yield interactions with our referring clinicians. And so I think that's really a misconception that needs to be done away with. The last factor would be sort of the technical component, where people think that you have to be really technically savvy and driven in physics to succeed in our field. I think it's great that STEM is emphasized more in our in girls going through schooling, but I think at the med school and med school level, people have this assumption that you have to be really great at physics, and that's why we have clinical physicists. We do take a test, of course, and have to be somewhat familiar with physics in imaging, but we do have our clinical colleagues in physics to help us. And lastly, in terms of looking at female leadership, I think that's a huge component of maybe why we're still struggling. There has been relative lack of increase in female leadership even over the last decade in our field. And I think this pattern of not seeing the desired female leadership, involvement, and mentorship that would be discouraging to anyone trying to look at the field to enter. And it's really important for a female professional to see that leadership ahead so that they can see themselves where will they be in 5 to 10 years. It helps to set realistic goals and expectations. And if that is absent and they see stagnation and dropping off of the curve, potentially in terms of promotion and achieving leadership roles, that will plant a seed of doubt and likely lead them to look and explore other fields where they're seeing more of a female leadership component. Thank you for your time. I hope we can all work together to further increase awareness of this need for diversity, specifically attracting more females to our field in the near future.